The CDC says that racism fuels health disparities in the U.S., so much so that the agency declared racism a serious threat to public health in the last year, finally addressing what many communities of color have known for generations. Thanks so much for staying with us on this Monday. I'm Tamsin Fidel.
And I'm Erin LeBeau. Today we want to talk about the ways that structural racism affects healthcare and what can be done to address it. So joining us now is Dr. Lynne Richardson, the co-director of the Mount Sinai Institute for Health Equity Research. Dr. Richardson, first of all, thank you for being here.
Thank you for having me.
All right, go ahead. Let's talk about what the unequal access to health care that exists for minorities in healthcare, what that is.
Well, again, just to start at the beginning, there are lots of things that affect our health. The food you eat, the air you breathe, the housing you live in, the neighborhood you live in, the type of work you do, and of course, the health care that you do or don't receive. And racism operates on multiple levels, both in society in general and in the healthcare system. There are long-standing structural inequities that are really embedded into our governmental policies and our institutional processes that systematically disadvantage Black and Latinx people. We call this structural racism, and this is really the result of decades of limited educational and economic opportunities. And this affects, of course, your health, because if you, the lack of opportunities lead to low-paying jobs that don't have paid vacation, may not offer health insurance. And so if you're struggling to pay rent and buy food and clothing, you might be able to afford to take a day off to see your doctor. Mm-hmm. And so often people will delay or forego medical care when they need it. And so they suffer avoidable complications of things like high blood pressure and diabetes. And all of these things affect your health.
Well, so let me ask you something, because here on PIX11, we've done a lot of stories about this because it's really, really important to be focusing on. When it comes to maternal health, Black women face a higher chance of dying from childbirth complications compared to white women. Let's talk about why that is, but also how it can be addressed.
Well, that's right. And in fact, Black women are 3.5 times more likely to die a pregnancy-related death than white women. And this is true, by the way, across all educational levels. So it's not just about education or information. Access is a big part of it, access to high-quality prenatal care and high-quality obstetrical care. But most of these pregnancy-related deaths are actually from cardiovascular conditions. Mm-hmm. And so the underlying higher rates of things like high blood pressure and diabetes predispose Black women to have worse maternal outcomes. And the tragedy is that most of these deaths are preventable. And not only do the women suffer higher rates of death, but the infants born to them are also more likely to die during the first year of life. Mm-hmm.
Well, Dr. Richardson, this is definitely a conversation that we'll need to continue bringing you back another day. Okay. But thank you so much for being here today.
Thank you.